Good afternoon, everyone. I'm Leilani Doyle. I'm the Director of Education and Awareness here at Senior Site Care. Senior Site Care is an organization that's solely focused on providing psychological and psychiatric services to the nursing home facilities and long-term care facilities in the state of Texas. In the course of our charter, we service better than 40% of the facilities in Texas. And this is our sixth series in our innovation webinar. It was a webinar series we started back during the height of the pandemic as a means to stay connected, because during the pandemic, one thing we needed was to keep close connection, and oftentimes that was limited. And we know facilities are impacted by that feeling of isolation and not having insight and information. So we are very pleased to give you today an update on the COVID-19 vaccination program and what we've seen. It has been a remarkable turnaround within the industry, and we are so thrilled to be able to present this content. In terms of a core value for senior site care, we are very committed to listening, learning, and sharing information every day. We use that information out to continue to deliver our standards in compassionate care to patients and facilities and to the staff members, listening to their needs and adapting there. We certainly went the extra mile during the pandemic to make that happen. But what we're seeing is that 2021 is really turning out to be a year of hope and change. And you will see some of the information we're presenting here today not only reflects that hope and change, but is targeted to give you the information to help everyone else in your circle, in your environment, to have the data needed, to have the insight needed, and to trust the vaccination program, and to continue to march forward so we can be free of this and return more to a normal business environment. We are joined here today by the team of the experts in this field. And I'm going to go ahead and introduce our featured speaker to give you a little bit of background. The Immunization Partnership has certainly been helpful in helping us gather information and data, information that we can share within our providers and can take to facilities if needed. Today, joining me are Allison, Winnike, and Rachel Walker from the Immunization Partnership. And they'll be telling us a little bit not only about the partnership, which has been instrumental in getting information out on the advocacy on the COVID vaccination, but also providing other support for other vaccinations, because it's not only this current virus, but regular vaccination care is critical to the health of the overall environment for long-term care facilities. Before we go into the information presented, what really sparked our need to present this information to a broader audience, and not only our constituents, but we've also extended this to anyone within the THCA membership. We are observing some phenomenal success stories. Senior Site Care is a data-driven organization. We use data to help improve our care, to manage our providers and make sure we have providers in the right places at the right time, and to also spot trends. And what we spotted during the height of the pandemic over the summer, that at any one point in time, for example, in July, we had 10 to 15% of all the facilities that we serve in Texas refusing entry. And some of those rates are higher for different kinds of services. So many of our providers are considered critical care. That was a pretty impactful number when you consider it wasn't the same 10 or 15%, but every week ones would come off the list, ones would go on the list. It was an interesting trend to be able to observe firsthand. Throughout this, we of course implemented some pretty aggressive telehealth techniques and adaptive devices to deliver our continuous care, but it was quite impactful for everyone, the patients, the staff who were struggling. Contrast that with March 2021, only 1 to 2 facilities per region, and we have divided the state into 3 primary regions, any restrictions at all. We have gone from hundreds of facilities being in a state of lockdown to practically nothing. And this happened all because of the vaccination program. There is a direct correlation. We saw it trending in February when the vaccination program started, and clearly in March that trend has continued. So it is a very tested success story. Sometimes when you see the vaccination, you wonder, is it working or not? This is a community that was very much impacted by the virus, and having this kind of success was enough confidence for me. Not only did I study the virus, and we had a previous webinar in December, but having the facts that it does appear to be working based on all this information, I went out and was able to get my first shot yesterday. So I think that that's a wonderful, wonderful set of information. And that's not alone. Senior Site Care has certainly been very big in supporting this vaccination as a means to quell the spread of the virus. And we've surpassed a 70% vaccination rate within our provider community. It could be higher based on providers reporting in, but it's a fairly remarkable feat to have, and within a couple of months for a company as large as Senior Site Care. In addition, anecdotally, where our staff is in the facilities day in and day out every day, and we have observed limited outbreaks. So the message there is that it is working. Allison, I thought maybe I would turn it over to you at this point to tell us a little bit more about the Immunization Partnership, what your mission is, how you're chartered, and guide us through this background information on the partnership.
Thank you so much, Leilani, and thank you for inviting us to be here today. The Immunization Partnership is a nonprofit organization. We are headquartered in Houston, Texas, and our vision, we're the only organization in the state of Texas who is focused on creating a community protected from vaccine preventable diseases. And we do that through our mission, which is to eradicate vaccine preventable diseases through our three mission pillars. One is educating the community, two, advocating for evidence-based public policies, and three, supporting immunization best practices. And so as the only organization that we're 100% focused on immunizations, we're really kind of the hub or the nexus connecting with private and public partners, government entities, health departments, hospitals, long-term care facilities, physicians, and just the community to make sure that we're all connected and getting that good information out about immunization so that we can increase our immunization rates and make sure that our community of Texans are well protected.
Yeah, I think that is a great perspective and a great mission for an organization. So I encourage everyone after this, we'll have some contact information on there. Please feel free to take a look at and learn more about how to get involved in this and see if there's a program that's right for your organization or there's some support behind that, because it is a critical factor. So we think about what is going on with COVID-19 today. I know most of the vaccinations that are out in the market tend to be the Moderna, the 2-dose vaccine, but perhaps you have some insight about what's coming.
Right now, what we have in the United States are 3 emergency use authorization vaccines. And so we have our Pfizer vaccine, which is an mRNA vaccine, 2-dose. The Moderna vaccine, again, mRNA 2-dose vaccine. And then most recently, the Johnson & Johnson, which is a 1-dose vaccine. All 3 vaccines are extremely, extremely effective in preventing serious COVID-19 disease. So that's really, really great news. Another thing that's really fantastic is that the side effects have been extremely mild and few. So that was another great piece of information. And just as we continue to collect more data, as clinical trials extend for more and more months, the data just looks better and better on these 3 EUA vaccines that we have. And so what we're expecting to see down the pike is some more vaccines as they get through their stage 3 clinical trials, start their applications for emergency use authorization. And what I'm expecting, I mean, already even with the 3 that we have, we'll have enough vaccines to vaccinate all adult Americans by the end of May, beginning of June. And we should start seeing some applications for emergency use authorization vaccines for ages 12 and up coming over the summer. And it very well may be that by the time school starts in the fall, we can get our children 12 and up vaccinated. And then just recently started the clinical trials in the under 12 pediatric population. That data is ongoing and will be collected. And then hopefully sometime in the fall, we'll start seeing some of that. And then fingers crossed by 2022, hopefully we'll have at least emergency use authorized vaccines for the entire US population, which will be great.
Clearly an amazing feat. I know it was impactful because we had such an impact alone in terms of the impact of the virus. But if we think back on looking at how we can get community immunity solved, it is very clear having that widespread adoption of the vaccine is critical. I know cases are decreasing overall, but some countries that have not had such effective immunization programs are experiencing uptakes again and are going back there. So I think it's important to have that build of community immunity. And is there anything specific you want to share about how that works or what the minimum numbers or percentages need to be?
The concept of community immunity or herd immunity is that the vast majority of folks in a population are vaccinated so that we can protect those who can't be vaccinated for whatever reason. Maybe they have medical contraindications or they don't meet the age requirements. And so for every single vaccine is different. And we're still trying to nail down exactly what the number is going to be for COVID-19. As the data continues to come in and the fact that this virus mutates quite quickly, the percentage that we're looking at that we need to get vaccinated to reach that community immunity, we're talking 85, 90, 95%. The number just keeps inching up because of these viruses. I'll tell you today, the news was released that now the most dominant strain spreading in the United States on COVID-19 is that variant strain that came out of the UK a couple of months ago. So already one of these mutant strains is now the most dominant strain. And that's why we're in a race, because every time we have another infection, that is another chance for the virus to mutate into something that can be more deadly and more contagious. And so we're in a race right now to get as many folks vaccinated as possible so we can slow down those mutations, because if we keep having hosts available for them, then it will be a long time before we can get out of this pandemic. And that's why it's really critical. And this slide, I think, really illustrates. You see, at the beginning, they thought, well, maybe if we could get about 60% of folks vaccinated against COVID-19, maybe that would be adequate. But as the data has continued to be collected, that number is looking like it'll be higher, towards 94%. But when you compare that's what we need in adults. Compare that on this chart with our immunization rates for adults for other vaccines. Pneumococcal, we're only looking at about a quarter of US adults are even getting that vaccine, which is, recommended. And pneumococcal and 65 and over and flu 65 and over, those are our highest adult vaccine rates at about 70%. We have to be much higher than our very best adult immunization numbers to get out of this pandemic. So that's why it's so critical that, especially in the adult population, that we get really everybody vaccinated. The concept we talk about in political science or economics about the free rider, well, there are not going to be any free riders in the pandemic, because we have to hit those vaccination numbers to get out of the pandemic.
Right. So it is very important. We're asking everyone on this webinar to please share that concept. It is sometimes when it looks like things are getting better, we may think it's not as critical. It's still very critical. And with the vaccination becoming more available, we need to get there to protect everyone. So how is Texas doing?
I would say not great. We're actually continuing to fall down in the rankings of states. And so this data was from Monday, and as of today, we've got about 16% of eligible Texans are fully vaccinated against COVID-19. Well, that actually puts us down. We're ranked 46 out of the 50 states plus the District of Columbia in the percentage of our population that's fully vaccinated. And also, if you just look at how effective we are at actually administering vaccines, we're only administering about 77, 78% of the vaccines that have been given to us by the federal government. So again, that puts us ranked down the list. We're ranked about 35th out of all the states. Many other states, they're up at an administration rate of over 90%. And so being down in the 70s for Texas, that means we have plenty of vaccine. We are just not getting it into everyone's arms. And that should not be an issue. We really should be using up every single vaccine because, as I mentioned earlier, getting to those community immunity rates means that we can't leave anybody behind.
Agreed. And do you have any reason why, I was looking at this percent fully vaccinated by county, is it the urban areas that are really struggling with the population trying to get the vaccine in the right hands? It's just so big, or do we have any indication about what's driving the lower participation rate?
Yeah, so there are a few different phenomena going on. So you look at your big cities, Houston, Dallas, San Antonio, Austin. They have received a lot of vaccine, but they are also extremely populous. And so it's just going to take a little bit of time to get all of those folks vaccinated. And so it's not that surprising to see them not at the super high rates, even though they have been doing a tremendous job getting folks vaccinated, but they also have a harder job to do. You look down along the Texas-Mexico border, several counties down in the Rio Grande Valley and out towards El Paso, they are just doing fantastic. And then a few other counties popping up in West Texas and North Texas and in the Panhandle. And part of that reason is they have smaller populations, but their populations are also very committed to making sure they're getting vaccinated. Some of them really suffered during the pandemic with a lot of cases, and so they really saw firsthand how important it is to get vaccinated. Now, you'll also kind of look, especially sort of in the East Texas area, there's a lot of counties that have low percentage of their residents that are fully vaccinated. That is a mix of reasons. Some of the things that we're seeing are just some increased hesitancy in those areas, or sometimes a decreased sense of urgency or need. Some of those places, maybe they weren't hit as hard during the pandemic, and so they don't appreciate how critical it is to make sure that folks are getting vaccinated. And so it's not kind of a one answer for the entire state, because in some places the demand really exceeds the supply, like in the larger cities where they're trying to get a lot of folks vaccinated, but in some other places the supply exceeds the demand, and we really need to make sure that they understand how critical it is to protect themselves and their communities and make sure they get vaccinated. And on this slide, this to me is a good news slide. When we first started polling about folks wanting to get vaccinated as soon as it was available to them, back in September, and this was before we even had any vaccines available to anyone, the numbers were quite low. I mean, you can look, about only 13% of Americans said, yes, I'll definitely get a vaccine. A lot of other people said, hey, I have some questions, I'm going to hold off a bit. Well, as the months have gone on, and this poll, which was published in February, we have seen those numbers continue to increase. And part of that is because now we actually do have concrete, solid scientific data coming out of these clinical trials, which is great. So people can read it, digest it, understand, see that these vaccines have been deemed safe and effective by the FDA, but also they can see their colleagues, their friends, their family have started to get vaccinated. And that also, increases confidence, because as we see, hey, mom, dad, grandma, grandpa, my physician, my home care worker, they all had the opportunity to get vaccinated first, and they're doing great. And they're actually so happy that they can start to sort of resume a little bit of more normalcy from all the restrictions that we've had for so long. And that does increase confidence. And I'll tell you, a poll came out in Texas also in February, and the numbers were about 51% of people were sort of in the yes category. They were in the yes, I've already been vaccinated, or yes, I am going to get vaccinated as soon as it's available to me. So that's good news. But the bad news is that 44% of the people were kind of in the no category. They were either no, I don't want to get vaccinated, period, or no, I'm unsure, I'm going to wait a while. And as you saw in those earlier slides, 51% of Texans getting vaccinated, that's not going to cut it. That's not going to end the pandemic in Texas. And that's why, and my colleague Rachel, who's, a real expert in talking about vaccine myths and vaccine hesitancy, really doing that outreach and dialogue with folks so that if they have questions, we're able to listen to those questions, listen to those concerns, and then be able to answer them with science and evidence-based facts.
In terms of the vaccine and the long-term care one, we've already shared some very specific numbers based on our bubbled up information on real practical use cases and our observations. And it was a very close community. If you think about it, we got the vaccine first, we were educated, and we had a very good, effective program for distribution. So the distribution came to the facility, it was tracked, it was organized, and honestly, for putting that out in such a short time, I was completely impressed with the effectiveness of the partners that were used, the distribution model that was used, and how that's transformed. I was shocked to see how well it worked and where we are today. It's quite enlightening in terms of how it worked in this control group and how it could work for the entire population. From our perspective in long-term care, patients all got in their program, they were encouraged to do that. They got the information, it came to them. Some of the staff were having concerns in terms of misinformation, getting the wrong sets of information. In any regards, we know that the impact in long-term care facilities was severe. We have seen this, we know the impact, and this is why long-term care facilities were given the priority and why Senior Site Care, as a proactive organization, went out and did a lot of education around the vaccination program and supporting our staff and giving them the information and getting that in the hands of folks sooner rather than later, because the impact to our facilities was great. The impact of us being able to deliver our care was very impacted. And we see that is something that has really changed over the last 2 months. So we know it's been working there. We did speak a bit about the available COVID vaccines as of April 7th. I know the vaccine that I just got yesterday was the Moderna vaccine. And Allison, I don't know if you might comment. I know you started some of these a little bit more, but in terms of talking about more specifics, are all of these readily available in the Texas area, and are they being distributed? And how does that distribution look for the Texas area?
Yeah, every single one of these vaccines is available in the state of Texas, depending upon your provider or the locations. Your provider may also have more than one vaccine available. We're starting to see, even on, the Pfizer vaccine originally had some more restrictive storage and handling that has now been reduced. And so we're even seeing Pfizer at big hub centers along with the Moderna. And Johnson & Johnson, the storage is very easy, and we're seeing that in a lot of mobile units as well.
The most of the experience I've had is with the Moderna, but what's required behind this, the effective rates seem to be consistent. Do you know if there's a trend in distribution?
Allison may know, but I'll say that, at the beginning we were seeing Pfizer mostly just because it received authorization about a week before Moderna. Pfizer, when it was first authorized, had to be kept at a super cold temperature. So it made distribution a little bit more difficult. So it was going primarily to large hospital systems that had the capacity. Moderna, there's a little bit more flexibility. So we'd see it going to a lot of your health clinics that would do more large scale public vaccination sites. And then the J&J, I know that their manufacturing, they've run into a couple delays. So I think right now it's still not the most popular of the three, but it also is the easiest to kind of handle and distribute. You're not as limited with temperature, and it's a one dose. So it's being prioritized for some of those harder to reach communities. I don't know, Allison, if you have any other insight about where we're seeing each specific vaccine go.
You're absolutely right. As I mentioned earlier, wherever you go, it could honestly have any one of the three. They really are distributed pretty well throughout the state.
Wonderful. So, and I know you said by May we should have enough vaccines available for everyone. In terms of some of the hesitancy And certainly maybe not within the facilities and not within our providers, but I know even within my own family, there are some concerns about getting it done, or maybe they feel like they haven't gotten it so far, so maybe they don't need to get the vaccination, or if it's safe. So in terms of how, I know one of it was the speed of development. Based on your research, I know that we did touch on that back in December. If you want to share some of these myths and how we can trust the vaccine other than proving to work.
Right, yeah. I think when we're talking to people who still haven't gotten it and are still thinking about it, the speed at which the vaccines were created is kind of the most common concern that we're seeing, both in the general public and then even individuals that may work in a healthcare setting. While the science community was really excited that we got these vaccines so quickly, some people in the public hear that and say, oh my gosh, well, is it tested? How do I know it's safe? So the ways that we were able to get these vaccines in this rapid manner, a couple things that contributed to that. One, we had a lot of existing research that kind of helped researchers hit the ground running whenever we discovered the COVID-19 virus. Previous coronaviruses like SARS and MERS that happened in the last couple decades both had vaccines that were in certain stages of development. Both of those coronaviruses never reached the stage of COVID-19, so the vaccine research just kind of fizzled out, but it helped researchers quickly pivot whenever we discovered COVID-19.
We're starting from no information. We had a good baseline, we had a good structure in it, and COVID-19 is a variant of the SARS. In fact, I think in the first way it's talked about included SARS in the official name of the virus.
Right, yeah. And then the other factor, I would simplify it as prioritization, both in the private sector and the public sector. Governments and companies realized that this was, we needed to find a solution for COVID-19. And so a lot of funding and money was given towards vaccine development. So we had hundreds of candidates being tested at one time, which is not normal. Usually there's a handful of vaccines. And so that just created an environment where we had more vaccines to be successful. And then in terms of testing, we didn't skip any clinical trials. So all of these vaccines were tested in human trial participants for a minimum of 2 months with follow-up data to ensure that not only are they safe, but they're also effective, because those are the bare minimums for the FDA to give the emergency use authorization. We need the vaccine to both be safe, it doesn't cause any serious concerns, but also it needs to work. It needs to really reduce infection and illness of the disease itself.
I've worked in government sector, I've worked in large corporates, and the way that we fit together and broke down barriers and stumbling blocks and roadblocks to get this done, it was unprecedented. We have to look at that as being, it was almost a wartime like effort to get it out there and get it out in the field so quickly and so effectively.
Absolutely, yeah. This is again some of the clinical trial data. I think that seeing those large numbers sometimes can be impactful for people who maybe have the idea in their mind that this vaccine, was released without being studied. We studied it in thousands of individuals. I have it bolded on this slide because I also think this is important, but 0 deaths were associated with the COVID-19 vaccine. In any clinical trial of that size, you may have individuals that do pass in the study period, but that can be for any reason that people normally pass away. And so in a clinical trial setting, we always investigate any death or any serious outcome to ensure it's not caused by the vaccine. So we have that data. We saw that the vaccines didn't cause any unexpected or serious complications. And in fact, the reactions are pretty short term and minimal, like Allison already covered. It's a little bit more than when you get your flu vaccine probably, but a slight fever, a little sore arm for a day or so is really what we're seeing. And some people have no side effects at all.
I got mine yesterday, and my arm hurt for a couple of hours, and that was it. I feel great.
Great, yeah. Yeah.
So this is again, aimed at providing the safety information. I think that effectiveness factor, that those are fully vaccinated are 90% less likely. One of the concerns with the 2-dose vaccine, I know, was a failure of the patient to come back for the second shot, and that is critical in making sure full immunity is achieved, and you achieve that herd protection discussed at the beginning of the slide. So do you know any data that's at all been a concern, or is everyone that's committed to the vaccinations for the most part gone back to get their second shot?
Right. Yeah, it's funny. I was talking to one of my colleagues yesterday. We were trying to find that, and Allison may know. I'm not sure if Texas has released, they have fully vaccinated versus one dose numbers publicized. I haven't seen kind of return rates. We do know that with any multi-dose series for adults, there's always going to be individuals that won't complete the series. Really just educating to the public that without both doses, you are not fully protected, I think is critical. And also there's a time component, even with your first dose and your second dose. As soon as you get the shot in your arm, you're not just good to be protected. There is a couple weeks where your body needs to work, it needs to build the immune response. Allison, if you want to say anything else about completing the 2-dose series, I haven't seen any data yet, but I know it's certainly something that a concern to ensure.
I got a little card. It was really nice. It looked so official, and it had my date with the doses and all this, my name and all that, and then the date to come back for the second card. It looks like this card is something that you might find useful. I don't know if it's going to be used for travel or whatnot, but I thought that was a pretty good incentive, a reminder to don't forget to go back. And this is important, and it's a good credential.
Yeah, absolutely. And I'll also add, it's been recommended to get that card laminated once you're fully vaccinated, because you'll definitely want to have that on hand as a record of your vaccination now and in the future on when you were protected and what was the vaccine that you were given. And talking about kind of return rates, that data hasn't yet been published by the state. It's still a little bit fuzzy. We really are trying, 3 weeks after your first, get your Pfizer vaccine, or 4 weeks after your first, get your Moderna vaccine. But there is a little bit of leeway was given, depending upon supply. And so I think once that supply problem has been completely fixed, and we're almost there, then we can really start analyzing those return rate numbers and doing that outreach and follow-up for folks who have not been able to get in, or analyzing the data to make sure that if they got their first vaccine at location A and they got their second vaccine at location B, that those are connected together as being fully vaccinated.
So I think that is really good points. And the other thing I've heard, and is really, again, in some of the conversations I've had, not only with our providers and with staff of nursing home facilities, but within the broader community, my children's friends, there's all kinds of misinformation that they're hearing on Facebook, and all kinds of untruths. And if you're not well informed, which is hard for everybody in today's world to be well informed, because so many folks are relying on social media for their source of information. In terms of sharing some common myths and ways that we can help spread that, disseminate that data, so that we know what's right. I did hear that they were afraid it was going to turn them into an alien, and they were kind of concerned about that.
The internet is powerful but dangerous, and I think we can see that with COVID-19 and the vaccine, and how misinformation can kind of just catch fire. I think number one tip whenever you are viewing something or sharing it, check the source. Your best bet for reliable information is going to be, your local health departments, your CDC, your primary care provider. Beyond that, I just want to real quickly debunk some of these most common myths that are contributing to some hesitation for people. Some people are saying that the COVID-19 may change my DNA or turn me into an alien, like you said, Leilani. It won't. That's just not how vaccines operate. This one is kind of, I think, related more to the mRNA vaccines, because mRNA sounds like DNA, but really all the vaccines are doing are sending instructions to your cells on how to make antibodies for the COVID-19 virus. That's the most simple way to explain it. There's a lot of great videos out there if you just want to search, like, how does mRNA work in a vaccine, that can show you kind of graphics, but it won't change your DNA. It'll just teach your body how to have an immune response to COVID.
The one I heard was within my company, and because we did get hit, and I do know that there was some talk about if you've had it, there's some 90 days of potential residual effect by having had the virus. It's still recommended. Is there a waiting time if you've had COVID-19? Do you need to wait before you get the vaccination?
Double check with Allison, but I believe it's just once you're recovered from the virus. The guidance has been slowly shifting. Allison, is that currently what is being advised?
Yeah, originally they did put it at a 90-day waiting period, but they have been able to revise that down some. Being infected with COVID-19 is not the same as being vaccinated against it. And even if a person was infected, they do still need to get vaccinated because that infection immunity does wear off and is not as effective as the immunity developed from the vaccine. And so that's why it is so critical. Even those who have been infected still go ahead and get vaccinated as well.
So in terms of any guidance, I know the attendees here on our call, they all have seen the front lines of this, and so they're all very well versed, but this information was meant to help empower them to go out and share it with the broader community so we can achieve that herd immunity that's needed. The numbers were phenomenal. We said 90% is what we need to target for, and the best we've ever gotten is 75% with the flu and the target age group. That's a big effort. It's a big grassroots initiative as well as public service initiative to get out in the market. Is there anything that we can do in terms of next steps before we wrap up for the afternoon?
Whether it's in your professional life or your personal life, continue spreading both factual information, sharing the safety data, the clinical trials, but then also if you feel comfortable, make it a little bit personal. Explain to people that this is your best chance at protecting yourself, protecting those around you. It's not worth risking a year down the line to see if you feel that the vaccine has been proven to be safe. It's been proven to be safe and it's been proven to be effective. So don't wait any longer for more evidence, because we also have evidence that an actual COVID-19 illness is very serious, and the outcomes from that are nothing to ignore or take for granted.
Agreed. I know we've given out a lot of information. We've talked about this there. Here's some ways to get involved in terms of if you need to learn more, if you are within your organization, if you are providing internal information with your new staff, patients that are coming in, and you need some support behind that. Here are some links that might be valuable for you and some ongoing action items. So we will share this information out after the webinar is over. Rachel, Allison, thank you so much for putting that together in terms of giving that support, because we know that this is group effort. We all have to get involved. It's a monumental task. It's one we all have to stay connected to, no matter what walk of life we're in, where we stand, what we're doing, what our job is. Our age group may be healthy, and healthy kids may not take it, but they need to get that protection as well, so they're not spreaders. On behalf of Senior Site Care and the Innovation Series, I want to thank you, Allison and Rachel, for participating in this webinar. Great information, statistics, facts that help us protect our community, that help our facilities and the communities we serve get more information and get it out in the community and use this as a forum. I want to invite you to say if there's any other ways that you can be of service, please let us know how we might get involved, or if there's a call to action, if there's something we should look at on the website or anything else to follow to help the effort.
Thank you so much, Leilani. We really appreciate you inviting us. I would recommend signing up for our mailing list on the website, because we do send out action alerts when there are critical things going on. And we know our partners in long-term care are just really out there on the front line, excellent champions and advocates and messengers to protect themselves and their patients as well. So thank you so much.
Senior Site Care is always here to help. We appreciate being able to bring education to our community. We know it's tough. We've got everybody on the webinar that's listening in. It's a tough job to do. You're very committed. I know it's a profession. It's commitment. It's one of passion, one that you care deeply about. So we want to give you a few minutes out of your day, once every other month, to connect with us, to learn something new and expand your horizons. I invite you to reach out if you need some help. We have access to a lot of data information and resources. We're here to support you. If you're one of our facilities, we're there. If you're just interested and you need some help, call us. We've got a lot of resources. We appreciate you attending and listening in. We will make this webinar available on our website as a replay, and we'll distribute out the slides to all of the registered attendees. And if you need copies, just send us an email and we will be happy to share that out. With that, I'm going to close out the webinar. Thank everyone, and I appreciate your attendance.